So indeed, I just got back from Sierra Leone, where we're working together with the team there to fight Ebola. The good news is we're really seeing dramatic reductions in caseload. So the Ebola crisis is finally actually starting to look, I'm not going to say under control, but we're definitely no longer in a frightening, out of control kind of phase. So a lot of empty centers, a lot of people recovering, and yeah, the things look a lot better. And the first thing I would like to say is that the mapping that has been done by OpenStreetMap and by missing maps has been extraordinarily helpful. One of the most important things in dealing with Ebola is contact tracing. If somebody has Ebola, I mean, the reason that Nigeria actually didn't suffer a terrible outbreak is because the moment it started, they aggressively traced every contact of the people who had actually had Ebola, and they managed to stop it before it got out into the wild. So at this phase of the epidemic, it's actually increasingly important to get out there into the communities and trace everyone who's come in contact with a known case. That's the way that we'll win the battle now. No longer just in the gigantic Ebola treatment centers where we're actually just receiving patients. And actually, what you've done, which up till now was only somewhat useful, because really what had to be done was simply provide enough treatment capacity for all the enormous numbers of cases that were coming in. At this phase of the epidemic, what you have already done in terms of mapping is now a critical tool, which is helping to stop the epidemic. So thank you for that. Wonderful work. While I was there, we did notice that in the district I was, which is called Tonkolili, we weren't able to map down to the village level. So if a patient comes in and says, okay, or we get a positive test confirmation from some village, we weren't able to track down that village. We were only able to do to the chiefdom level, which is, there's dozens or even hundreds of villages in a chiefdom. That's not good enough to actually identify the hotspots and go out and proactively stop the transmission. So we started doing some motorcycle mapping to try to get down to the village level. So what we did, and I've been waiting for years for this to be possible, was just ask the local villagers who's got a phone with a GPS on. Installed some open source software on their phone, actually OpenStreetMap for Android, Osmand, as well as Open Data Kit, ODK Collect. Taught them how to use it. So isn't this extraordinary? Just add knowledge. We didn't have to bring any equipment. We just brought the knowledge of how to get the right software, which is free and available for everyone, put it on their phones and send them out there. The total cost of a team with a person, a telephone, a motorcycle, and a rider for the motorcycle was 28 euros a day. They were doing on average 10 villages a day, so it cost 2 euros and 80 cents to put a village on the map. And we were collecting not only the name of the village, but the alternate names of the villages, the name of the chief, the phone number of the chief, the name of the healthcare worker, the phone number of the healthcare worker, an estimate of the population. So incredibly useful data. Now when an epidemiologist or a clinician is trying to trace down a patient, they can actually take the origin of the patient, okay, district, chiefdom, section, village, all right, look it up, let's call. If you don't get through, okay, then let's look at that village and where's the nearest healthcare center where they are referred to, let's call there. So it doesn't replace contact tracing and outreach and surveillance, but it certainly helps it. So what we've got now is this massive database of 1,000 villages. So kind of in our spare time, over the course of about 10 days, we mapped about 7% of Sierra Leone this way. We have that database of villages, which we're now integrating into the OpenStreetMap database. And the next steps, which we'll talk about as things come, will be to actually then trace those villages, the shelters, to compare against the population estimates, start ground truthing so that we can actually see how the tracing and the missing map style thing that we do correlates to this information that we actually get live. So hugely useful data set, and of course, open for everyone, as is all the stuff that we are doing. So very exciting, once again, to be in contact with the field and you guys at the same time. And this was actually something I've dreamed of for a long time. I was actually calling Andrew and Dale in the United States to support this ongoing whilst we were doing the field mapping in the midst of an Ebola outbreak. So good stuff. Thank you all very much. I'm around for the evening, and anybody who has questions or interests, it's easier to shut me up than it is to get me talking. So yeah, all right. Thank you.